Hello again. Welcome to another session of the Medication Mathematics course. In today's discussion, we are going to continue our look at medication labels. The objectives for this short discussion is going to be the same as the objectives we discussed earlier when we talked about unit conversions. Why is it important for you as the nurse to be able to read and interpret medication labels? Medication labeling is related to the safety of medication administration. A wrong interpretation of labels can lead to medication errors. Common types of medical errors resulting from misinterpretation of labels includes the following: giving the wrong dose, giving the wrong medication. For example, there are some medications that sound alike. We have an example of Percodan and Percocet. If you don't read these labels carefully, you might give one medication in place of the other. Then, another way that we can make an error if we misread or misinterpret medication labels is to give the right medication but through the wrong route, such as a medication that was meant to be given intravenously, which means through the IV, could be given intramuscularly, which will mean giving it through the IM route. We can also give the wrong dose of the medication if we don't read the label. This can cause an overdose, which may cause adverse reactions from the patient, such as anaphylactic shock or respiratory depression or death. We can also give an underdose of the medication, which will lead to incompetent care. So misreading the drug formulation or concentration can result in an overdose or an underdose. The question therefore is, what are the components of a drug label that we should be paying attention to? On every drug label that you find, you are going to find these basic components. There are more components, but I believe these are the ones that you need to pay particular attention to. The first component on a drug label is going to be your brand name, or what we sometimes call trade name. This is the name that has been given to the medication by the manufacturer. Then we have the generic name. So those of you who took biology or chemistry, the generic name is kind of like the scientific name. That is the common composition of that medication. The chemicals found in that medication usually is how we derive the generic name. Then we have the formulation or the concentration. This tells you the amount per unit of medication contained in that particular bottle, vial, or whatever container the medication comes in. Then you have the total amount in the container. This tells you the total volume or weight of the medication. Then you have the lot number. This lot number is important to note, especially if you are giving vaccines, because if there is any reaction or adverse effect from that medication, we can track it down by the lot number to see who received which lot number. You are also going to see the manufactured and expiration date. The expiration date is very important because you don't want to give an expired medication to your patient. So when you pull your medication, you always have to ensure that it has not gone past the expiration date. You are also going to find storage information. The storage information tells you how to safely store the medication. Remember that medications are made of chemicals, and chemicals can react, and temperature and the way you store it plays an important part in these reactions. For example, some medications will have to be stored away from light because light can break down the chemical components of the medication. Other medications will have to be stored in the refrigerator because it needs a particular temperature to maintain its chemical composition. The next component you are going to find on a medication label is going to be your reconstitution information. Some medications come in powdered form, and you may have to add a liquid to reconstitute it so that it can be given to your patient. And so if the drug requires any reconstitution, you are going to find this information on the drug label, and you have to follow the reconstitution instructions to accurately and safely reconstitute the medication. The last component that I'm going to talk about is the drug schedule. This tells you if the drug is classified as something that needs to be monitored closely or not. I'm trying to break this in very basic terms so you understand. You are going to learn more about drug schedules when you take pharmacology. So basically, drugs are grouped according to whether they are a controlled substance, such as some pain medications. An example would be morphine or Percocet, or whether they are uncontrolled substances. So the schedule information will tell you whether this is a Schedule 2, which will be controlled, or any other schedule that you need to pay particular attention to. Now that we have considered the component, let's look at some examples of drug labels, and I'll tell you what these components are. So this is an example of ibuprofen drug label. So as you can see, you are going to find some of these components on this drug label. The first component we talked about is the drug name. In this case, ibuprofen is going to be the generic name for this medication. Think about the ads you see on TV about ibuprofen and see some of the names that you can come up with as brand names or trade names. The second thing that you are going to see is the formulation. So this tells you the concentration of the medication. So this is saying that there are 600 milligrams in every one tablet. Then it tells you the total amount, which is going to be 500 tablets. The expiration date and lot numbers are going to be found at this section, and then you are going to find the manufacture date. You are also going to find all the storage instructions on this section of the drug label. Let's take a look at another example. This is a drug label for an infant Tylenol for pain relief. And so you are going to see the brand name, which is going to be Tylenol. The generic name, however, for this is going to be acetaminophen, which is right here. Right under there, you are also going to find the concentration or the formulation. So according to this label, the concentration of formulation is 160 milligrams per every 5 milliliters. This is important when you are doing your drug calculations. You are also going to find the total volume, which is 30 ml in this bottle. And then on this side, you are going to see the drug information, which will include the dosage for children based on weight or age. You are also going to see storage information, reactions or potential adverse effects that may come as a result of the use of this. And you are also going to find some data which is required by the FDA. We will not go into details. On the bottom here, you are going to see the lot number and the expiration date. Let's consider an example of a drug that is a scheduled drug. So this is morphine sulfate, and this is going to be the generic name. The total volume is given over here as 10 milliliters per each vial. The concentration of formulation is 10 milligrams per ml, which will be 1 milligram per each ml. And then the route of administration is also given here, which is IV, epidural, or intrathecal. We will talk about this when we learn in pharmacology. Then it gives you the schedule. So this is the schedule here, and this is a Schedule 2 medication, which means this is a controlled substance. On this side, it gives you some information about how to store this medication. It tells you to store this at 20 to 25 degrees Celsius. When converted to Fahrenheit, this is going to be 68 to 77 degrees Fahrenheit. It also tells you to protect from light, because light may cause chemical reactions that degrade the components of this medication. It also tells you to not heat or sterilize. And so you see a lot of the components that we have talked about on this drug label. Let's look at another medication label that has the formulation stated differently. This is ondansetron, and ondansetron is a medication for nausea. So in this, you are going to find the generic name, which is ondansetron. The brand name can be Zofran. It tells you the total volume, which is 2 milliliters per each vial. That is the total amount you have. Then it gives you the formulation, which is 4 milligrams per 2 milliliters. And it also tells you the route of administration, which is IV or IM, which means you can give this intravenously or intramuscular. So if you have 4 milligrams per 2 ml, you can simplify this and say 2 divided into 4, 2, 2 divided into itself 1. And that is how they got the 2 milligrams per ml. And you are going to need this formulation to calculate your dosage once you receive a prescription from the provider. There are some medications that we have to reconstitute, as I mentioned, and one of the components you are going to find on either the drug label or on the insert is the reconstitution instructions. So for example, we have Protonix, which is going to be the brand name or trade name. Pantoprazole sodium is going to be the generic name. So this is the generic name, G, and this is the trade or the brand name. On this, you'll find the lot number and expiration date, and then it tells you the formulation. So this tells you that you have 40 milligrams per vial. Now, it's not giving this to you as 40 milligrams per ml because we have to reconstitute. And when you look on this right side, let me wipe some of this up so you see. When you look on this right side, you are going to find information on the reconstitution. So if you can see this, it says reconstitution needed. See package insert. And so we are going to go to the package insert to make sure we reconstitute this right. Normally for Protonix, you are going to reconstitute with 10 milliliters of normal saline. And then you can give it afterwards. It also gives you some storage information, and it says to store at 68 to 77 degrees Fahrenheit. These are some of the basic components that you will find on a medication label. So, another example of a drug that has to be reconstituted is vicodinium bromide. This is for IV use, so it gives you your route of administration. And then it tells you that you are going to get a formulation of 1 milligram per ml when you reconstitute with 10 milliliters of whatever liquid solution that the manufacturer instructs you to use. So for example, here it says that it can be reconstituted with the supplied bacteriostatic water for injection, or you can reconstitute with sterile water for injection or compatible IV solution. And the package insert will give us more information. So normally we use either normal saline or sterile water to reconstitute medication. Why did we get 1 milligram per ml? Well, you have 10 milligrams of the medication. And so if we reconstitute with 10 ml, we divide 10 milligrams per 10 ml, 10 will cancel itself 1 and cancel here 1. So we have 1:1. So you have 1 milligrams per each ml. This is the concentration or the formulation that we need to reconstitute or to do our calculation after we have reconstituted our medication. Invans is another example of a medication that we normally reconstitute. So Invans is the brand name or trade name, and then you have the generic name that is ertapenem sodium. And this is for IV use, so it gives you the route of administration. And then you have the batch number, which is also the same as the lot number. I think some European countries prefer to use batch numbers. And then you have the expiration date. So you have to make note of the expiration date to ensure that your medication is not expired. Okay. It gives you some storage information and then reconstitution information on this side. Then it gives you the dosage. So this is 1 gram in the vial. So you have 1 gram per vial. And then you also have some reconstitution information. Okay, so basically these are the components that you are going to need every time you pick up a medication. You should be able as a nurse to read these labels, interpret it, and use it for your medication calculations, or to just verify if you are giving the right medication through the right route and giving the right dosage. So remember, we talked about the right of medication. It is important that we pay attention to medication labels because it can help us to avoid unnecessary medication errors. Thank you for listening to this presentation. I will see you in the next presentation when we start using these labels to actually do some medication calculation problems. Take care.